What is spine injury? So a spinal cord injury, or known as SCIs, is a damage to the tight bundles of the cells and the nerve that send and receive from the brain to and from the rest of the body. So this SCI can causes by first the damage of the spinal cord itself, or the damage from the tissue and the bone, the vertebra, that's surrounded by the spinal cord. What is cervical spine? So basically, cervical spinal cord injuries are the most serious of all spinal cord injury, and they can happen on either side of the body. So this injury to cervical 1 and cervical 2 are very rare, and most injury to the cervical spinal column occurs near the C4 and C5 levels.
The definition of lower back pain is lumbar will feel discomfort such as pain, muscle tension or stiffness that occur below the costal margin and above the interior gluteal fold. Human had 5 lumbar bone. Low back pain also pain that isn't caused by a known pathology. Patient need to make medical checkup at the hospital to know about their injury or their pain. There is a lot of causes that can influence to low back pain, such as kidney stone, heavy lifting, trauma after fall, pure sitting, posture, frequent bending forward and degenerative condition.
Proceed to the middle back pain. Okay, basically the middle back pain is a pain or a discomfort at the area between your upper and or lower back, which is at the middle. Okay, the healthcare professional refers to this area as the lower thoracic area and or upper thoracic area that makes up part of upper back. Okay, basically, middle back pain, also known as a thoracic back pain, is when the pain is above the bottom of your ribs, which is about your waist, where your waist sits, which is between your shoulder blades and below your neck. Between your shoulder blade, shoulder blades and between your neck. Okay. Pain in the middle of the back can be either short-lived or chronic, can be lasting for more than 3 months. Okay, and then this middle back pain may be described as a dull, annoying edge, or a sharp or acute pain. Okay, now we proceed to the lumbar region. Okay, basically as we can see on the picture at the side, we can see that each lumbar level is numbered from the top to bottom, and most people have for about 5 lumbar levels, which was listed from L1 to L5. Okay. Basically, the low back vertebral bodies are larger, thicker, and thicker block-like structures of dense bone, which is the lamina, or the bottom one is a thin bone plate that protects the access to the spinal channel. Okay, now we proceed to the functions of the lumbar spine. There are four main functions, which is first one is support and stabilize the upper body. Second one is allow truncal movement. The third one is to protect the spinal cord and cauda equina. And then the lumbar spine also serve to move the body, which is the motion that include was such as flexion, extension, rotation, and also side bending. Okay.
Anatomy of cervical spine injury. So as you can see in this picture, we have 3, which is the atlas, the axis, and the C5. So the atlas has no process and vertebral body due to its connecting to the axis, and it is replaced with a lateral mass that serves as connection to the occipital bone of the head. So to facilitate the rotational movement, the axis contain broad process that stick upward and fit the axis. So basically, the cervical 3 and the cervical 6 are referred to as normal vertebra, since they share the same characteristic with other vertebra.
Okay, now we move to anatomy of the low back injury, which is herniated disc. Herniated disc is just like disc situated between the vertebra or bone building block of the spine. This situation is a issue which one of the rubbery cushion or disc that sit between the various bone or vertebra that stack to build your spine is referred to as a herniated disc. These can deteriorate with age, making them risky to damage.
Now we go to the anatomy of injury for herniated disc. Herniated discs are known as slip disc, degeneration of the disc due to aging, an injury or trauma to the spine and excessive strain on the back.
Okay, now we proceed to the anatomy of injuries for the middle back pain. Okay, basically, middle back pain, it's a spine. Okay, our spine consists spinal column, spinal cord, nerve, disc, ligament, and also tendon. Okay, between the vertebra, as we can see on the picture, we can see that between the vertebra are spongy sacs of cartilage called disc that act as a cushion and also provide a range of motion to the back, to our bone. And if any of the structure of the spine that I told before, which is ligament, tendon, and so on, can be irritated or inflamed in response to a variety of mild to serious injury, to serious condition. Okay, basically, the pain at our middle back can be either short-lived or chronic, which is basically it was last long for about 3 months. As if we are repeatedly performing the same motion at the same area, can also exaggerate the muscle tissue and damage our small blood muscles that cause pain in the middle back region. I proceed to the anatomy of injury for kyphosis. Okay, kyphosis is known as an abnormal rounding of the upper back, and it was a common condition that often develops for adolescents and also young teenagers. Okay, the kyphosis can cause discomfort and lasting issues throughout the body. And then the primary symptom of the kyphosis is an abnormal forward curve in the upper part of the spine, and in mild cases, the spinal curve is not always noticeable, but it can be seen that our head move forward like this. Okay, there are 3 types of kyphosis, which is postural kyphosis, Scheuermann's kyphosis, and also congenital kyphosis.
Common injury for cervical spine. So first we have trauma and non-traumatic. Let's see the trauma first. So trauma is the most common causes of cervical injury, and this can include by the motor vehicle accidents, falls, penetrating, the blunt trauma, sport-related, and also driving injury. For non-traumatic, can include by compressions of fracture from the osteoporosis, the arthritis, the cancer, and inflammation of the spinal cord.
Okay, the most common cause of thoracic back pain is inflammation of the muscle or soft tissue of the thoracic spine. This inflammation can occur for a number of reasons. First, a sudden sprain or strain at the muscle, sitting for a long time, and also lack of muscular strength.
Common injury of low back pain is strain and sprain. Strain occur when muscle fibers begin to tear as a result of overstretching or overuse. Meanwhile, sprain occur when ligaments are overstretched or torn. This soft tissue function is to help hold the body upright and support weight from the upper body. If put under too much stress, the low back muscle or soft tissue can become injured and painful.
Next, we go to the common injury at the joint for herniated disc. It can causes by low back pain. This may be continuous or intermittent. It can be also worse by cough, sneeze, prolonged standing, or particular movement. And the next one is sciatica. Sciatica, when a herniated disc is pushing on certain nerve, patient may find the pains that starts from the buttocks or back of the thigh and travel down the leg to the calf, sole of the foot, or even to the toes. This usually affects only one leg, but occasionally it can affect both legs. This is the figure of the sciatica.
Proceed to the common injuries at the joint. Okay, basically the middle back pain can caused by poor posture, arthritis, muscle strain, and also car accident injuries. Our middle back pain is not a common a common pain, which is such not like a lower back pain, because our thoracic spine does not move as much as the spine at our lower back and also our neck. If we having the middle back pain, it also can accompanied by chest pain, difficulty breathing, loss of bladder or bowel control, and numbness or paralyzed in the arms or legs. Okay, the pain at the middle back can be described as a dull, annoying edge, or a sharp, acute, and also an acute pain, which is it can radiate or spread to the other areas of our body, yeah, such as arms and legs. We proceed to kyphosis. Okay, as we know, the kyphosis is an abnormal curve at our back, which is the symptom that we can see. The common symptom that we can see is we could have the back pain, stiffness at the upper back, or rounded back, and also tight hamstring. Okay, the causes for this kyphosis is poor posture, developmental issues, older age, because I have told that it was basically can happen to the adolescents. And then the last causes is abnormal vertebral shape. Okay, the complication for the kyphosis is the first one, we can see an irreversible hunch in the back. And the second one is persistent back pain. We can have the back pain commonly. Okay, weakness or numbness in the arms and leg, and then breathing difficulties, and then lastly the loss of bladder control.
So next, we go to the do and don'ts for strapping and K-tape. First point is, do clean the surface of injury to be taped. Don't apply the tape immediately before or after exercising or showering. Second point is, use underwrap to prevent skin inflammation and strengthen adhesive for rigid taping. Don't touch the adhesive of the tape. The third point is, do round the edge of kinesio taping, and don't never apply to broken or frayed skin.
What is kinesiology tape? Kinesiology tape is a type of therapeutic tape that support muscle and also joints, while also reducing discomfort. Athletic trainer, athletes, and also physical therapists frequently use it. So, what is the benefit of kinesiology tape? First, reduce or relieve pain. The second one, decrease inflammation, reduce swelling, and the last one will be increase blood flow.
I'm going to show you how to do kinesiotaping for people that have cervical spine injury. Let's go. Cervical spine will begin with short Y strip and I strip. What I'm going to do now is remove the backing for the anchor that will be placed on the neck. And I'm going to place that anchor right around the C7 area and apply it to skin without any tension. Then what I'm going to do is remove the paper backing on each tail to a couple of centimeters. I'm going to apply the tape to each side of the neck with the neck flex at about 25 to 50% tension. And then, what I'm going to do is apply each anchor of the white strip without any tension. And I'm going to gently wrap the tape with the paper backing to activate the adhesive so that it will be our first strip for our cervical spine taping. Next is we use the eye strip. And what I'm going to do now is start with a bend 8, turn right in the middles. And next, I'm going to pull those sections apart until I reach about 50% tension and apply it directly over about C7. Now, we remove the backing of each anchors and apply those anchors to the skin without any tension. And the last one is gently wrap the tape to activate the adhesive, and this will give us our Kinesiology taping for cervical spine.
Okay, first of all, prepare two slightly longer tape and also two slightly smaller tape. Apply the tape to offload the erector spina and apply the tape transversely across rhomboid area. Make sure the athlete flex a little bit and round their shoulder. Take a longer tape and start from rumba C71 directly through to mid scapular region. And make sure to stretch until 10%. Repeat the same movement for the other side. Start from rumba C71 directly through to mid scapular region and make sure stretch until 10%. Next, take the smaller tape and place at scapular area and apply 75% stretch across onto the next scapula. Lastly, apply the smaller tape at lower part of scapula and make sure to apply 75% stretch across to the next scapula.
First, your patient need to sit on the stable surface and he need to bend forward to stretch the back muscle. Second, place the base of the blue strip over the lowest part of the back on one side of the spine without stretching the tape. Take the second tape and apply along the other side of spine. Wrap the tape Rub the tape to activate adhesive. And last one is tear backing along center tear line. Then begin removing backing in both directions to expose middle portion of tape. Apply 50% stretch, then apply tape horizontally over the most painful area.
Okay, now we proceed to the procedure for middle back pain. Okay, we are using H pattern. This is because it was a simple and effective way to reduce pain and inflammation in the area. Okay, basically for the middle back pain, we have to prepare for about 2 strips of tape that measure from upper back down to lower back, and also 1 stripe of tape that measure from one shoulder to others across mid back. First of all, let the patient stretch the skin with a hug and focusing on rounding the mid back. With 0% of stretch, apply the tape upwards and make sure that the tape should point down. And then, repeat the step for the second strip that apply on the opposite side and parallel with first strip. And then the last strip are applied at the center with 100% of stretch, which is we have to apply to the painful area perpendicular to the previous strip. Lay the end with no stretch, then rub to activate the adhesive. Okay, now we proceed to the tapping for postural correction, which is kyphosis. Let's go. Okay, first of all, make sure that the patient keep the shoulders back and upright with no slouch through the upper spine, with the head keep facing forward. Next, apply the tape from the front of your shoulder and pulling the tape back and down, and make sure it was crossing over the spine of the opposite side of the mid back. Repeat the same thing for the another side. Now tape for forward head posture correction. We use stripes of tape from below the base of the hairline and down over the upper curve of the back.
Hi everyone, so today I'm gonna show you guys how to do a strapping for herniated disc pain, or known as slip disc. The procedure is get the patient in a prone position and make sure they completely flat. The third step is run a strip of tape on each of spine. Like you can see in this video, I make a 2 line of strapping at their spine. So this is the run to strip, and then you have to make a cross tape on each side of tape. So you can refer to this video how I make a strapping for the patient of slip disc.
As the conclusion, we know that the spinal cord is very sensitive to injury. Unlike the other part of our body, the spinal cord does not have the ability to repair itself if it is damaged. So early immobilization and treatment are the most important factor in achieving recovery from the spinal cord injury.